organized by the Department of Medical Education, JIPMER, Puducherry. I am Dr. Jayaprakash Rajan, Additional Professor and Head of the Department of Medical Education, Puducherry, and I will be working behind the scenes of today's webinar. The topic for today's webinar is problem-based learning in medical education, delivered by a team of faculty from St. John's Medical College, Bangalore. Before I hand over the session to our speakers, here is a short introduction about today's topic. It is a known fact that the 21st century has seen many innovations that has influenced the way we communicate and learn. The field of medical education is not an exception to this, because a lot of advancements have taken place in teaching and learning of medicine across the globe. One among the increasingly implemented ideas in the field of medical education is problem-based learning. Problem-based learning is a teaching learning method in which complex real-world problems are used as the vehicle to promote student learning, that is, students' learning of concepts as opposed to direct presentation of facts and concepts. Problem-based learning is an educational approach whereby the problem is the starting point of the learning process. Though problem-based learning has been a concept in existence for decades, yet its implementation in medical education is limited. This is due to lack of awareness and training among the faculty and other stakeholders in medical education. Today, we have with us a team of speakers from St. John's Medical College, Bangalore, who will be discussing the concept and application of problem-based learning in medical education. Now let me introduce all our four speakers. Dr. Nachiket Shankar is the professor in the Department of Anatomy. Dr. Lakshmi is an associate professor in the Department of Anatomy. Dr. Mangala Rao is an assistant professor in the Department of Pharmacology. Dr. T.V. Sejil is an assistant professor in the Department of Physiology. All the four speakers are active members of the medical education unit in their institute and are actively involved in faculty development programs. And we are really happy to have them on our for this program, and we are really grateful for them for having accepted amidst their busy schedule. I now invite our speakers to start their presentation. Dr. Nachiket, you are welcome, sir.
Thank you, sir, for that kind introduction. So I am Nachiket from St. John's Medical College, a faculty member from the Department of Anatomy and Medical Education. And it is indeed a privilege for our team to be here today for this webinar. And at the outset, I would like to thank the organizers, NTTC and Department of Medical Education, JIPMER, Puducherry, and especially Dr. Jayaprakash for inviting us to conduct this webinar. So it's a real pleasure and privilege for us to be here for this webinar. So I'm going to start by providing a context for this session. And before we actually go into delve into what PBL is all about, this is just a brief context so that it's more understandable what we're going to proceed with. So I'm going to start sharing my screen. Yeah. So St. John's introduced PBL into the MBBS curriculum way back in 2008. However, the preparation for the introduction of PBL into the curriculum started 1 year prior to its actual introduction. And like Dr. Jayaprakash mentioned, it is not widely utilized in medical education, at least in India, because perhaps there's not that much awareness, and that it is also a resource-intensive method of learning, though it can be very effectively used. So in St. John's, the key faculty responsible for the introduction of PBL were the following. We had Dr. Prem Pais, who was our then dean in 2007. And he had very strong connections with McMaster University, which, as you will find out, is one of the pioneers of introduction of PBL in medical education. And at the same time, we had a senior professor of medicine, Dr. Tare, who had just returned from a stint in the Caribbean, where he was introduced to the concept of PBL, and PBL was widely utilized there when he went there for his sabbatical. So he thought, why not introduce it in India as well? And around that time, we had the head of the medical education unit, as it was called then, Dr. Swarnarekha. And I remember her saying that our students are not thinking enough. So we need a method to ensure that the students think about what they are studying, right? It's not pure rote memory. So because of all these faculty, there was a thought that we could introduce PBL in St. John's primarily to make students think about what they learn. And the three main faculty who were responsible for initiating and implementation of PBL at that time were Dr. Sanjeev Lewin, who's probably well known to all of you. He's a pediatrician and very active in medical education. Dr. John Stephen, who's currently our head of the Department of Medical Education, a dermatologist, and Dr. Sunita, who's a professor and head of ophthalmology at St. John's. So these were the three faculty who actually implemented PBL in St. John's. And after that, many of us were co-opted into PBL and have become PBL converts, so as to say. So from 2008, the PBL program has metamorphosized, and it has three components now. We have a facilitator workshop, which we conduct for facilitators in PBL, and we conduct it for outside faculty as well. We have an orientation program for the students because it's a completely new method of learning and they need to be introduced to the method. And then we conduct a short 2-month PBL program, which we'll be looking at in greater detail as the session progresses. So with this background, this is the schedule for the webinar. So the first speaker will be Dr. Lakshmi, and she'll talk about the need for PBL, especially in the current educational scenario with the implementation of CBME. Next, Dr. Mangala will delve into the details of PBL because there are often a lot of misunderstandings about what PBL is. So she's going to clarify those aspects. And then I'll be talking about assessment in PBL, and we'll wrap up the webinar with Dr. Sejal, who will give us some ideas and insights as to how PBL could be implemented in the Indian context. So before we actually go into the webinar, this is the format for the webinar. We will have 4 mini lectures in total. We'll have a set of 2 mini lectures initially, followed by interaction with the audience, and then the next 2 mini lectures followed by interaction with the audience. So please feel free to ask questions, and you can type your questions into the chat box, and we will try and address all the questions that you have. So we do hope that it's a fruitful learning experience for all of us. And without further ado, I hand it over to Dr. Lakshmi to talk about the need for PBL in the current scenario. Thank you. Over to Dr. Lakshmi.
Thank you, Nachiket. Am I audible?
Yes, Dr. Lakshmi, you're audible.
Thank you. Give me a minute to share my screen. So I was just looking through the participants, and I was very glad to see a lot of my friends, and I hope would be friends also after this session. So warm welcome to all of you. Glad to see all of you. Is my screen clear?
Yes, Dr. Lakshmi.
Thank you. Thank you. So let's take a few seconds to look at this picture. Just to jog your memories, I'm sure all of you are a little bit knowledgeable, definitely about PBL. So we will come back to this picture later on at the end of this small mini lecture and discuss what it means. Yeah. So in this session, I will be talking about the 4 parts of PBL, mainly the history of PBL, what exactly is the definition of PBL, why PBL, and specifically PBL in the present CBME scenario. Okay. Coming to the history of PBL, PBL emerged as the result of an attempt to reform medical education at McMaster University in Hamilton, Canada, specifically in 1969. So there were a lot of founding fathers, a group of physicians and basic scientists who worked towards making PBL what it is today. And this method became so popular that it spread all over the world. And we have complete universities and medical schools which totally use a PBL type of curriculum, specifically in Netherlands, Australia, Ireland, of course, in United States. So it would be amiss on my part if I do not mention Dr. Howard S. Barrows, who is the father of problem-based medicine, I should say. He is an American neurologist and a medical educator, and he joined the McMaster University as a faculty of medicine and developed the PBL method of learning. So he then also went to the South Illinois University of School of Medicine, and there he established the Institute of PBL. So not just PBL in medical sciences, he promoted use of PBL even in secondary schools. So he was a very firm believer in the PBL method of learning. Of course, he has many other contributions to the world of medical education, clinical reasoning, using simulated patients, etc. But PBL has been his gift to medical science. So coming to the definition of PBL, as in the words of Dr. Barrows, it is a learning method. So let me stress on the word learning. It is a learning method that uses problems as a starting point. So just like, maybe a small dust particle which allows a pearl to form, the problems here form the nidus for acquisition and integration of new knowledge. So this is the definition of PBL, and a bit about how it differs from the traditional method of teaching. I think this picture tells us what traditional teaching has become now. So you have the passive students and the teacher who doles out information. There is no interaction of the students with the information that has been given to them. They are just passive recipients. So in toto, what happens is there does not occur any amount of deep learning. It is more or less a lot of rote learning and superficial learning that happens. And you can see the difference here. More or less, we can say that PBL is a democratic form of learning, and the students actually decide on their objectives. They build their knowledge on a nidus, which is the clinical vignette or multiple things that can be used to trigger off this discussion. And the teacher is a facilitator. Okay. He or she makes sure that there is a non-threatening atmosphere where the students can practice whatever they require in their future roles as doctors. So it gives a wonderful platform for the students to learn. So more details we will be seeing in the next session by Dr. Mangala. So going into why PBL. So I'm sure most of you have gone through the CISP, and the one thing that is reiterated again and again there is the roles of a basic medical doctor, that is an MBBS graduate, of being a clinician, a leader, a communicator, lifelong learner, and a professional. So what I would like to say here is that PBL actually gives a perfect platform to practice the knowledge required to be a clinician, leadership, because it's going to be a team-based learning, communication between the participants. They're going to learn how to, solve problems in the real life. So a lifelong learning method, and of course, interaction with the team members allows them to behave like a professional. So it gives a wonderful platform or a scaffolding for them to practice. So not just this, I'm sure as you went through Many of you, of course, have already implemented the new curriculum in your own colleges. I'm sure you will agree with me when I say that integration and self-directed learning are the cornerstones of the present CBME curriculum. Of course, I have not mentioned feedback here, but definitely it is all inclusive in self-directed learning. So in brief about what integration is and how PBL fits into this. So integration is the organization of teaching matter to integrate or unify subjects frequently taught in separate academic courses or departments. So what happens is more often the knowledge gained is by means of, thinking of trying to clear the exam or the subject exam. So the real life patient and what he or she as a professional has to deal with when he becomes a practicing doctor is somewhere lost during this focus on trying to clear exams. So I'm sure all of you are familiar with this ladder, Hardin's ladder, which has 11 steps. And I'm sure you'll agree with me when we say that the earlier steps of isolation, awareness, harmonization, nesting, we are trying to put the timetable together. We are trying to, engage with the other subjects in the same phase. More or less, it's a physical integration that is occurring. And integration in the true sense has to actually occur in the minds of the students. And here, if you see, PBL stands at the 11th step. So it is actually the final transdisciplinary method of learning, that is the actual purpose or integration in its, in its perfection, I should say, can be achieved with PBL. So just to use poetry, I'm sure all of you are familiar with Rabindranath Tagore's poem, Where the Mind is Without Fear. So there is a line in this poem where he says, where the world has not been broken up into fragments by narrow domestic walls. So I'd just like to twist this and say, where knowledge has not been broken up into fragments by narrow domestic walls of subjects. So that is where PBL will take us. It is not subject that we are going to focus on. It is going to be the problem or the patient that becomes the focus of learning. So the other cornerstone of CBME is self-directed learning. And I'm sure you'll all agree with me that self-directed learning requires readiness to learn, setting goals, actually engaging in the learning process, including searching for resources, discussing this. Of course, in self-directed, it is with oneself, but in a PBL-based learning, it could be with the team members, and of course, evaluation of learning, which comes from feedback from the team members. So problem-based learning is a wonderful method that propagates self-directed learning, which is one of the best methods for lifelong learning also, since it includes both self-monitoring and self-management and requires a lot of discipline. So I'm sure with all this background of problem-based learning, the objectives of PBL would be again into all the three domains of learning, that is knowledge, skills, and attitude. So focusing on knowledge, the main objective of PBL would be to bridge the gap that exists between basic sciences and clinical sciences. The students, what they tend to do is they try to find answers in their basic sciences for all that they see in the clinical case scenarios. So PBL acts as a bridge, helping the students find answers for their clinical questions based on their basic sciences knowledge of anatomy, physiology, and biochemistry. Of course, the other subjects also. Coming to the skills, definitely scientific reasoning, which occurs during the discussion that occurs between the team members in PBL group. Critical appraisal, very much so, because it is a non-threatening environment where everybody is allowed to ask questions. So whatever information is brought forth to the table is questioned by the others. Authenticity is questioned. Where is the source of information? And very important, source of information, authenticated source of information also is very important, and that is what makes PBL very much important in the present context where we have an overload of information. So as we've already gone through self-directed learning and lifelong learning, which are also skills that PBL will help hone. Coming to the attitudes, yes, value of teamwork. We all know that healthcare today is a teamwork, and the best health that can be provided to the society is definitely through teamwork, and this can definitely be practiced in PBL. Interpersonal skills, these are all soft skills that can be very much developed during PBL sessions. Psychosocial issues, yes, unfortunately in the present scenario, what happens is the psychosocial issues related to a patient is sometimes overlooked, and we try to bring a focus into these issues also using the problem or the nidus that we give the students, so that the students also looks into the usefulness of, you know, asking the patients to maybe go in for many tests, or, you know, prescribing drugs, looking at the economical status of the patient, affordability, etc. We definitely go into all those issues. So in brief, what usually happens is many of us do use problems to teach our students. But there, the final outcome is usually just simple solutions or answers to the case scenario or problem. But in problem-based learning, what we do is we use the problem to gain more knowledge or acquire new knowledge founded on a scaffolding of basic clinical skills. So the objective of problem-based learning is to acquire new skills, whereas what we usually do in giving students problems to solve is to find answers or solutions. Dr. Mangala in her session will give you an example of a trigger where she will exactly tell you how and when we use these problems to improve student learning. So at the end, I would like to say that I'm sure if you are all practicing PBL in your own medical schools, you will have this issue. The trouble with PBL is that you have to learn a whole bunch of stuff that you won't need now, but definitely when you are a practicing physician, this is a lifelong method of learning that will hold you in good stead in your professional career. So that is what we tell our students. And as a summarization of what we covered, we went through the history of PBL. It started at McMaster University, 1969, with Dr. Barrows being one of the propellants of this method of learning. Definition of PBL, it is a learning method. Let me stress once again on the word learning. It is a learning method that uses problem as a starting point to acquire and integrate new knowledge. And we have seen why PBL is important, because definitely it helps learn or solidify the learning what is required by a basic MBBS graduate of being a clinician, a lifelong learner, good communicator, a professional, and a team player. And specifically in the present CBME scenario, self-directed learning and integration, the two cornerstones of CBME, is definitely fulfilled by a PBL method of learning. So I would like to end my session with a quote. Sure, you're all familiar with this. Give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. So on similar lines, give a student information and he's learned for a day. Teach him to learn and you make him knowledgeable for a lifetime. So thank you all. This is the slide that we started with, and I'm sure it is very clear how PBL makes the student a self-directed learner, and where we, the teachers, are the facilitators for learning. So the student decides what he wants, what are the objectives, how he's going to learn, the resources. The teacher gives feedback and facilitates learning, providing a non-threatening atmosphere. So with that, I complete my mini session. The next session will be by Dr. Mangala, and maybe questions we can have after Dr. Mangala's session on the process of PBL. Thank you very much.
Thank you, Dr. Lakshmi, for that very clear presentation on the need for PBL in the current context. So what we'll do is, before we move on to Dr. Mangala's session, there have been a number of questions and comments. So I'll very briefly run through them. And some of them we'll take during the second interaction session, and some of them we'll take during the first interaction session after Dr. Mangala's talk. So first was PBL during the lockdown. What were our experiences? So that we'll deal with at the end, after all the 4 lectures are done, because that's sort of more logistic detail. We will look at that. The second is triple jump assessment of PBL. Dr. Nalini has asked that. So again, that we'll deal with during the second interaction session. The third question is, are PBL and ECE compatible? So can PBL be used for ECE? That I think we'll leave to Dr. Lakshmi to answer at the end of the first interaction session. She can share her thoughts. Difference between PBL and CBL. Again, that's Dr. Siraj's question. We can deal with that during the first interaction. Then Dr. Joseph's question, is PBL more important for the clinician or basic scientist? That's a more sort of a philosophical question. So we will look at that. And again, during the first interaction, how is PBL useful for faculty and teachers? Again, Dr. Joseph has asked that. We'll look at that. And Dr. Raghavendra has asked about the time and infrastructure, whether it's possible in India. So what we do is that question we'll take during the second interaction. Okay, so we have noted down your questions and we will certainly discuss them. But in the interest of time for now, we will move on to the next session. And this session will probably clarify some of the doubts that you have. And over to Dr. Mangala. She'll be talking about what is PBL.
Yeah, thank you, Dr. Nachiket. Just allow me to share my screen. I think Lakshmi went about really motivating everybody, right? Particularly by the quotes of Rabindranath Tagore, where, she said that this is the ultimate, right? So I'm sure all of you are motivated enough. Before I begin, I hope I'm audible.
You're clear, Mangala.
Yeah, and is my slides visible?
Not yet.
Okay, I'll just go back. Okay. Nachiketa, is it clear in the sense that it's...
Yeah, it's clear. It's clear.
Okay. Yeah. So I guess, as I was saying, Dr. Lakshmi really motivated all of us, right? It almost seemed as if this is the way to go or way to learn. So all of you must be wondering, how do we go about implementing this particular program? So what I'll be dealing with are the steps and particular roles, in problem-based learning that each of the stakeholders need to play. Sorry, I think the slides, yeah. This is the overview, and this is what we'll be covering in today's session, that is requirements for a PBL session, the various steps which are going to be involved in a PBL process, and the roles of the two main stakeholders, that is the students and the facilitator. I always like to call the person involved as a facilitator rather than a tutor, because we end up learning more in these sessions. So let's move on to the requirements. The picture, kind of says it all. It requires the students, then of course a facilitator, and a case or a problem or a trigger, whatever you would like to call it as. The rest of it, the greenery and the fresh air is a bonus, which we have in plenty in our campus. And those of you who are fortunate enough to have such campuses, please do make use of this. I would say these are the basic requirements. Another thing that this picture kind of emphasizes, that PBL is a small group teaching learning method. The whole class is not here. So it is to be divided into small groups. Of course, right now we have a little larger than the groups that you are seeing here, because we do have 150 students now, and a facilitator for each of the group. So the basic requirement is that you need many facilitators to facilitate this process, and the students need to be divided into small groups. And then, of course, you need a trigger or a case. So those are the basic requirements for any PBL. So moving on to, once you have these things, how do you go about a PBL process? Each of the session or each PBL session is an iterative process. That is, you keep repeating the steps. That's how the process happens. The students, they read the trigger that is provided to them. Then they brainstorm, and then they hypothesize, which is an integral part of the PBL process, where you learn from each other rather than on your own. Then they all come up with learning issues. Whenever you read a trigger, some of the items there you already know very well, some you do not know at all. So you brainstorm, you hypothesize, and then identify the learning issues. You take back those learning issues. Usually each of the student takes one objective, one learning objective as his or her own. They research and learn in 2 to 7 days. Usually in what we follow at St. John's, there is a minimum gap of at least 5 days. So 5 to 7 days is what we follow. But there have been PBL programs where they have only 2 days of research time. So, but in St. John's, we do give them at least 5 days. So they research and learn, then they return, and that is, they come back as a group, report whatever they have learned over the past 5 to 7 days, and then again review with all the information pooled on the table. They reread the trigger, and then they review what they have learned and what else is left to learn. And of course, at this stage, they usually get the next trigger or the next part of the case, and this process continues. So that's how any PBL session or a process happens. That is, they read the trigger first, then they brainstorm or hypothesize, identify learning issues, they research. Once they take back the learning issues, they research about that particular learning objective, get back to the group, report what they have read, and with all the information on the table, review their stand, read the trigger, and go through these steps again and again. So that's how a PBL process happens. Of course, in the center of it, we have the assessment or the evaluation, which Dr. Nachiket is going to deal with later in detail. So I'm not going into evaluation right now. So once you have looked at this, just to take an example, I'm giving you an example of at least the first 3 steps that happens in any PBL process. This is a trigger. This is an actual trigger from one of our cases, even though I have trimmed it a little bit so as to fit in here. So basically it's a case, I'm not going to read the case as a whole. Basically it's a case of a 60-year-old man who has presented with fever and productive cough. So once you give the trigger to the students, they read this trigger, and what they do next is to brainstorm and hypothesize. Probably in whichever phase, in whichever year they are in, they already know the causes of productive cough, and they probably know the significance of blood in sputum. And why do you even need to ask history of smoking? Probably. I'm not saying all groups will know only these things. I'm just taking an example, you know. And till now we used to conduct a PBL in 5th term. That is, they are in the 2nd year of MBBS when they get their PBL experience in St. John's. So, so this is what happens here. So in the brainstorm, that is in the session they are sitting in, they brainstorm and hypothesize, and they all know these things. So what next? The next half of the group discussion would be on identifying the learning issues. Probably none of them know the causes for coarse crepitations, the difference between coarse and fine crepitations and the importance, and also what is bronchial breathing, where do you find it, what is the clinical significance, and so on. So these are, like I said, it's an example of the first 3 steps that they go through in any PBL process. They get the trigger, they brainstorm and hypothesize. That is, they literally split the case into small pieces, take each piece, examine, see what they already know about it, and list out what they do not know and take them as learning objectives. The next 3 steps are nothing but, once they take these, you know, learning objectives as their own, they do more research, either by literature search, textbook, looking at a case, etc., and get back to the group. Okay, that would form the 5th step, and then they get the next trigger. So this is just an example of the steps or the process involved in PBL, any PBL session for that matter. So what we have covered just now are the requirements to form smaller groups, to have facilitators, and to frame these triggers, and then the steps of the PBL process. So what else is left? The main thing are the roles of students and facilitators here. The trigger, as we know, it has already played its role. So what we are left with are the roles of facilitators and students. How similar or how different is it from a traditional teaching? So let's go ahead and see this. If you look at PBL process as a whole, these are the different roles that each of them can play. That is, to be a scribe, a tutor or a facilitator, a chair, and a group member. The beauty of PBL is, except for the tutor or the facilitator's role, the role of a scribe, chair, and a group member are all played by a student. That's where what Dr. Lakshmi called about the attitudes, the skills develop, rather than not only the cognitive part, but the objectives of PBL are to develop both the skills and the attitudes that is satisfied by playing these other roles. So let's see what each of these roles entail. As a group member, a student should follow the process. Even though the picture is small, it's the same iterative process that I put up a little earlier. Participate. As a group member in PBL, participation is very, very important. The student needs to participate. Once they take home the learning objective, they need to research. even though the picture shows only the books. Nowadays, students use, of course, internet more and more, but we do encourage them to go back to the cases. The patients are the most important learning tool that they have. Go back to the cases or to a clinician or a consultant to clarify. Ask questions. In a group, the discussion is not complete if each one of them just, kind of gives in what they know and don't ask questions. The hows and whys should come up in the discussions. So ask questions. Active listening and respect. Here is where it is very, very different from a traditional teaching, where, the student has to listen only to a lecturer or a professor who is teaching them. No, here they learn to respect their own peers and also actively listen. Active listening is contributing to the whole session as such. And of course, sharing is very important. This is all for one and one for all. So whatever one learns, it should be shared with everybody else. So I would say, in a nutshell, these are the various attributes of being a group member in PBL. So let's look at the special roles, so-called special roles in PBL. What is it to be a scribe in a PBL session? The main role of a scribe is to record. Whatever happens in the discussion, the scribe kind of records it in a systematic manner. We'll see many of them writing notes, but it's the responsibility of the scribe to take it down in a systematic way. Here I've shown both a laptop and a book because many of them do take notes directly on their laptops. Of course, participate. Being a scribe does not mean that the student ceases to be a group member, So the student has to actively participate. Order the thoughts. Whenever people are in a group, usually the thoughts come randomly. And of course, in PBL, that is allowed. The PBL, it is allowed to think, aloud and to get random thoughts. All that is allowed in PBL, but it becomes the responsibility of the scribe to maintain these thoughts in order, so that there is a, systematic manner in which the particular discussion is going on. Next comes recording resources. As Lakshmi already pointed out, this becomes a very important activity of the scribe, because even though there is an information overload we see on the net, it is very important to rely on reliable resources. Of course, textbooks are really reliable, but the problem with textbooks is the information may not be as up to date or as current as we require it to be, right? So it's important that the scribe records resources, not only for their own use, but later, if it is passed on to a next group, they should be able to get the information easily by recording resources. It could be a consultant. It could be, they could have gone to a cath lab. One of our cases is MI. During that, the group with which I was working, they took permission from cardiology and, they visited cath lab. So it could be anything. So record resources. So recording, participating as a group member, then ordering the thoughts and to record resources. These are the main roles of a scribe. So there's only one more role left for a student to play, which is that of a chair. Of course, the main role of a chair is to lead. This is where it is different, very different from a traditional teaching learning method, where the students learn how to cope. They have to lead the group, they have to maintain the group. All these skills or attitudinal skills, soft skills that they develop are going to be through this process. So one of the responsibilities of the chair is to lead. If no discussion is happening, then the chair kind of starts the questions or takes up some issue and says, let's discuss about this. Those become the responsibility of a chair. other than he or she themselves participating, encouraging participation becomes another important attribute of a, chair. That is, they need to identify people who are quiet or who are not participating, and then to pull them into the discussion is the role of a chair. To maintain group dynamics, any group, I think all of us have this experience. Some will be very silent, some will dominate, some will refuse to listen, right? All of us have seen this happening in a group. A silent person doesn't mean that he or she doesn't have anything to contribute. The most dominant person not necessarily means that they know everything, right? All of us have had this experience. So it becomes the responsibility of a chair to maintain the group dynamics. That is to, politely tell the person who is very dominant or always talking like me, to say that, you better listen to the other person also, or encourage. I keep giving this example. Sejal doesn't talk much. So keep encouraging people like, Dr. Sejal to speak more in the group. Maintain focus. Whenever there is a group of not only students, even faculty for that matter, not necessary that we stick to the same subject, right? We tend to waver this way and that way. So it becomes the responsibility of the chair to maintain focus, to get everybody back to the case or back to the trigger that they are discussing. Keep time. Again, a very important component. Everybody's time is valuable. So the chair usually keeps time of, we have these sessions for around 2.5 hours. So 2 to 4:30 is the PBL time that is allocated, but most of it go till 5. So keeping time depends on, it depends on the group. If they have all agreed to stay back till 5, that's fine. Okay. So keep time and then work with the scribe. This becomes very important because the scribe is already orderly maintaining the thoughts and then putting all the resources in place, right? So if the chair works with the scribe, the whole group can go in a single specific direction and kind of learn better. Let me just clarify, in PBL, you are allowed to think laterally. When I mean single direction, it does not mean problem solving. It can still be, a wide range of learning, but, to at least maintain the objectives getting fulfilled. So these are the roles of a chair. Remember, the chair and the scribe also do play the role of a group member. Apart from that, the chair leads, encourages participation, maintains group dynamics, focus, keeps time, and also works with the scribe. So right now we just covered all the 3 roles of a student in a PBL process. One is to be a group member, second one is to be a scribe, and third one is to be a chair. So there's something special about the roles of a chair and scribe. That is, in this particular session, if these 2 were the chair and the scribe for the next PBL session or the trigger, it could be 2 other people. We do encourage this in our institution so that all the team members get the experience of being a chair and a scribe, and also develop their soft skills of leading, improving communication skills, maintaining group dynamics, and so on. So this is part of the PBL process. So if everything is done by the students, what is the role of a tutor or a facilitator? It looks as if we don't have much to, do, right? And here the tutor seems to be having fun, but believe me, that's what happens most of the times. Encourage participation. In the first few sessions, the chair is very new to his or her role. So it falls on the responsibility lies with the facilitator to encourage participation, assist group dynamics, and timekeeping. This is slightly overlapping with the roles of a chair. But in the beginning, the students are new to this process, so we may end up doing these roles for them. Monitor the scribe if the record keeping is happening, systematically. Prevent sidetracking. Whenever I am the facilitator, we set the ground rules, in the beginning of the PBL process, that we take a break after around 1 hour and we talk about something else other than academics. We call this the free time. So they'll have something to talk about Autumn Muse, which is a fest which goes on in our institution, or something else that they have attended, sports. Sometimes they do have questions for me, personal questions. So it's up to you to decide when to do it. But other than that, the later part of 1 hour, we stick to the trigger. Okay, so prevent sidetracking, ensure achievement of objectives. Again, I reiterate this point here. In PBL, you don't have a single case to solve. It's not as if, you need to come to a diagnosis at the end of the trigger. No. Many a times the diagnosis is already given in the second trigger. Okay. Somebody asked in the chat box, what's the difference between case-based learning and, problem-based learning? I would say that's the main difference. Problem-based learning, you can go into anything in detail. It's up to the group. It's up to the whole, team to decide. But at the same time, there are some must-knows in every particular trigger. And this is known to the facilitator. So it becomes our objective, or it's our responsibility to ensure that the must-knows have been covered by the students. So that's why I have kind of bold, put that in bold, achievement of objectives. Even though it's not hard and fast rule that if there are 10 objectives, all 10 have to be achieved, at least around 6 to 7 of them need to be covered by the students, or the must-knows of a particular trigger has to be covered. Check understanding. Sometimes what happens, students just, get information from a internet source and they copy and just come and deliver this. It's like a conveyor belt. They got it from there and kind of putting it here. So it becomes our responsibility to check understanding, or have they really understood what they are saying, before we kind of ensure that everybody else is also learning these things. So these, and of course, assess performance at the end of each session, and again at the end of the PBL program, becomes a responsibility of the facilitator. Again, assessment, it could be in knowledge domain or the skills domain, interpersonal skills, etc. You will listen to this more in Dr. Nachiket's session. So in a nutshell, these are the roles that a tutor facilitate or a facilitator does. The first few things may be an overlap with that, with the role of a chair. But of course, checking understanding, achievement of must-knows, and then assessing performance is definitely the role of a facilitator. Having said this, there are some things that the facilitator should not be doing in a PBL session. Express opinions. In my opinion, I think this is a case of tuberculosis. No, a facilitator will not be allowed to do that. Second thing is give too much of information. All of us have been traditional teachers for this long. So it's very, very easy, very, very tempting to start taking a mini lecture, which we should avoid. And believe me, that's the hardest, particularly when our own subject matter comes up. For me, treatment, the moment they start discussing treatment as a pharmacologist, I am itching to give them more adverse drug reactions, more this, more that. But no, we can't, we should not give too much of information and allow them to collect this information and synthesize. So in a nutshell, we have covered the roles of the students and the roles of facilitators, and also we have emphasized on what a facilitator should not be doing. So basically, this is what happens in a group. We have around 6 to 7 sessions of PBL, and this is what we see in every year after year. These are the Tuckman stages of team formation. There is a stage of forming, where some people are still quiet, they're not very comfortable and all that. And there is a phase of storming when everybody wants to talk, including yourself, or ourselves, I should say. And then there is a stage of norming where they know their roles, they know that they have to learn through this process. Okay, that is the stage of norming. And finally, performing. Some students have come up with brilliant concept maps. They have, as I said, one group went to the cat lab. I didn't know what happens in our own cat lab, and they took a video and they kind of came and presented here, which was excellent. So that's the stage of performing. So all groups, believe me, go through this: forming, storming, norming, and performing. The initial stages of forming might feel a little, the facilitator is a little lost, where to step in, where to kind of keep quiet, but that comes with experience. And believe me, once it's reached the stage of norming and performing, we will enjoy the whole process. So I guess I'll stop now. And of course, this is the honeymoon frustration and settling down. So what we covered in this session was requirements of a PBL session, students, small group students, facilitators, and a trigger. And as I said, as a bonus, the fresh air and the lawn and the greenery, and the steps and the roles of students, tutors, and facilitators. We are open for questions. Thank you.
So, yeah, thank you, Dr. Mangala, for that really clear presentation on the steps for PBL. I'm sure that would have clarified many of the doubts that the participants had. There have been a lot of questions in the chat box, but we may not be able to address all of them. What I will do is a few of them that I can quickly address, I will do right now. One was whether PBL can be used in the paramedical students. Yes, it can be used. It can be used in almost any setting. Second question is, in St. John's, do we use PBL curriculum, or do we use it as a teaching learning method in a traditional curriculum? We use it as a teaching learning method in a traditional curriculum, right? So we don't have we are far off from having an entirely PBL curriculum. So we use it as a methodology to encourage students to think. Lot of discussion about PBL versus CBL. If I want to put it in one sentence, CBL is very structured and is more teacher driven, right? The questions are asked by the teacher and the students are supposed to answer those questions. So it's very structured. Whereas, like Dr. Mangala said, in PBL, students are given the trigger and they have to explore and identify their own learning objectives. So if there's one thing that's different, main thing that's different between PBL and CBL is the students determine their learning objectives in PBL, whereas in CBL, it is still very much decided by the teacher. And the questions are asked by the teacher and not by the student. Of course, there are a lot of articles related to CBL that you can please go through. And there are a lot of other questions as well. Maybe we'll have time for maybe one or two questions. One was, can PBL and ECE go together? So maybe Dr. Lakshmi can try and address that because she's the first year. She's been involved with ECE. Over to Dr. Lakshmi.
Thank you, Nachi. As you all know, ECE has two components, right? You have the clinical component and the basic sciences component. And I'm sure the exposure to the clinical side where the students have to visit the hospital, that cannot be replaced by anything. So PBL, let me tell you, is a method of learning. It does not replace bedside teaching in any manner. Somebody else had also talked about bedside teaching. So PBL does not replace bedside teaching, but definitely in the basic sciences of early clinical exposure, as a problem, a clinical problem for the student discussion, PBL can definitely be used in this scenario. Definitely, you can have a clinical case and discuss that with the students. And you can do this as a PBL method also. Does that answer the question? I'm sorry, I've forgotten who has asked. I just
Yeah, I think it's pretty clear. I think Dr. Aruna had asked that. Dr. Aruna had asked that. And then a few other things, Dr. Lakshmi, for you.
Yes.
Clinician or basic scientist, is PBL better for the basic scientist or clinician, or is it good for both?
See, PBL is a method of lifelong learning, and I feel personally we may not be consciously using PBL, but as far as I know, that is what we do have something called as a Friday clinical meet, which occasionally we have complex cases from the hospital that we discuss in front of all the faculty. So that may not exactly be PBL, but I somehow feel when you do post-graduation and you go a little higher into adult learning, PBL is what you actually do. So I'm not sure whether you can, separate it out and say that it should be for a clinician or it should be for a faculty. It doesn't matter. A PBL way of learning is a lifelong method of learning for anybody, and not necessarily just even as Dr. Harrows has done, not necessarily only for the medical curriculum also. It starts from school, so it could be applied to any field.
Okay, thank you, Dr. Lakshmi. So before we start my session, a couple of things. We do conduct a PBL facilitator workshop, a 2-day workshop where we go into depth of the PBL process, and it prepares you to be a facilitator at your college. And if you want to start a PBL program at your college, it might help you to do so. So we will keep you informed of any such workshops that we conduct at St. John's. And the other thing is that how is PBL useful for faculty and teachers? In many ways. In fact, all of us are here speaking to you because of PBL. Probably we would not have entered our MEUs but for PBL. So I think what it does is it sort of brings faculty from different departments together, and it sort of dissolves the boundaries. Okay, so in the interest of time, I will stop the interaction here, and I will move on to my session, which is on the assessment of PBL. Okay, so I think all of you would agree with this. We can escape bad teaching, but certainly we can't escape bad assessment. And just as an aside, we can sort of bunk our classes. I think many of us have done that, but you can't bunk exams because otherwise you won't go to the next stage. So I think that sort of tells us about the importance of assessment in the whole educational process. So let us reflect for a few seconds about why assessment is important. So please think about why assessment is important. Of course, all of you have probably experienced in medical education. I don't need to go into this, but we'll just pause for 30 seconds and think about this. Okay. So to put it in a nutshell, assessment is important to see if we have achieved our learning outcomes, right? So it's important both for the students and for the faculty to see whether we have achieved our learning outcomes. And that supposes that our learning outcomes need to be defined. And if we put this in the context of the PBL, the objectives of PBL were clearly stated by Dr. Lakshmi. So therefore, the assessment in PBL has to be in alignment with those objectives of PBL. So we're going to look at 4 questions in relation to assessment. We're not going to deal with why, because I think that's sort of a given. Assessment is really important. And we're not going to deal with the other questions. So we're going to look at who, when, what, and the how of PBL assessment. So we're going to deal with these 4 questions. So let's start off with the what is assessed in PBL. So like we said, the assessment in PBL has to be in alignment with the objectives. And I'm going to restate the objectives because this is extremely important for the assessment. So we need to assess whether the knowledge objectives of PBL were met. And if we recap, the objective of PBL was to build bridges between the basic sciences and the clinical sciences, right? So right now they are in watertight compartments, but it's just a body of knowledge that we have to tap into. So there is actually no real difference between the basic sciences and the clinical sciences, and they have to be looked at together. And PBL is supposed to do that, right? It's supposed to integrate the basic sciences and the clinical sciences. Coming to the skills, like was mentioned earlier, PBL is supposed to enhance the scientific reasoning skills of the student and the ability of the student to critically appraise a problem or a trigger that is given and identify learning issues, and also to find out resources, suitable resources to plug those gaps that they have identified, right? So all these are the objectives of the PBL, and this whole process of identifying gaps, looking at resources and then plugging those gaps will make a student a self-directed lifelong learner, because that's what every clinician does on a day-to-day basis. The third objective of PBL, as has already been mentioned, is the attitudinal objective. It enhances the value of teamwork and interpersonal skills, which are critical for the practicing clinician. The clinician never works in isolation, always works in a team. And PBL, one of the objectives of PBL is to encourage the student to do so, and also to improve the empathy of the student, as there's an opportunity for students to look at various psychosocial issues that are associated with the triggers. So if these are the objectives of PBL, then what is assessed? So one, of course, is the content, right? We want to see the content. For example, that arrow is pointing. Let's say that trigger could be related to a patient with tuberculosis. So that is the content aspect of problem-based learning. But the beauty of problem-based learning is that a lot of emphasis is laid on the process, right? The process, Dr. Mangala has very clearly described the process. So that process also has to be assessed. So in PBL, just for the sake of explanation, we are going to divide the assessment into assessment of content and assessment of process. So before we come to the actual assessment, who assesses whom in PBL? This is another unique feature of PBL. It's like a 360-degree assessment. So the student assesses himself or herself, then assesses the peers, that is the group in which they were working, and there is also feedback given to the tutor, and the tutor also gives feedback to each student. So you can see that there is a 360-degree assessment that occurs in PBL. How is assessment done in PBL? So if we go back to the content and process, the content can be assessed. What we use, it can be assessed in many ways. What we use in St. John's is concept maps, because concept maps are a wonderful way of seeing whether the student is able to integrate the basic sciences and the clinical sciences, right? So on one sheet of paper, the student draws all the different concepts and illustrates the topic and sees how all the different aspects are interconnected and interrelated, right? So we use concept maps for assessing the content in PBL. Of course, there are many other methods that could be used. We could use higher level multiple choice questions. We could use essay questions, modified essay questions, and potentially we could also incorporate clinical reasoning and higher level thinking skills into an OSCE in the form of a response station, right? So these are the various ways or possibilities of assessing the content in PBL. How do we assess the process? Informal feedback is given at the end of each session by the tutor and is also gathered from the students. Feedback for the tutors gathered from the students, and that is done at the end of each session, right? So that's informal feedback. We have a whole series of questionnaires that we use that we have adapted from the Queen's University PBL manual. Those of you who are interested can please note down this. You can just type in Queen's Manual PBL, and that's the manual that we follow here in St. John's with a few modifications. And there are a whole set of questionnaires that we utilize in order to assess PBL, especially the process. And finally, there is something called the triple jump exercise. I think one of the audience asked about what this is. We don't use this in St. John's, but I'll briefly explain what this is. In the triple jump exercise, the student is actually given a trigger for the assessment, right? And they will have to identify learning issues, then find out resources in order to address those learning issues, and see whether those learning issues have been learned or not, right? So that's why it's called a triple jump. So it just mirrors the process of PBL. So we do not do that here in St. John's, but that is done in many other universities. And if you look at it, that is essentially what all of us do in daily life, right? We identify gaps in our learning. We identify resources to plug those gaps, and then we test and see whether the gap has been filled or not. So that in essence is the triple jump exercise. So a little bit about each of these methods of assessment. This is a concept map of a concept map. So here's the concept map. This is the main topic. A concept map consists of arrows, concepts and ideas, a hierarchical structure, and it also has a main concept, right? And each of these concepts in relation to a concept map can be connected by arrows. These are called connectors. So if let's take the example of tuberculosis, right? So this could be, for example, the anatomy of the lung. This could be the physiology of breathing. This could be the Ghon's focus. This could be caseating necrosis. Okay, so these are important concepts in relation to tuberculosis. And these arrows will sort of determine how all these different concepts in relation to this topic are connected. So it's a beautiful way of seeing whether a student has understood the interrelatedness of the basic sciences and clinical sciences in relation to a particular topic. And what we do is we assess the map construction, how well it has been constructed, and of course the detail, whether the content has been covered or not. Now we will move on to other aspects of the process. We have a self and peer assessment and tutor to student assessment. And in this, it's a perception questionnaire, right? Which students answer and the tutors answer. It's the perceptions of the students and the tutor. So whether their critical appraisal, whether they have improved their skills in critical appraisal, whether the learning resources were utilized appropriately or not, whether the group worked well or not, how well the group worked, and whether the attitudes and the communication skills were good or not. Okay, so we look at these 4 broad aspects in these questionnaires. Of course, each of these aspects has a number of items linked to them, and it's beyond the scope of this session to go into the details of this. Now, coming to the student to tutor, what does the student assess the tutor for? The knowledge, attitude, and skills, not in relation to the topic, by the way, right? It's in relation to the PBL process. How knowledgeable is the tutor about the PBL process? With what attitude does the teacher or the tutor come into the session? And how good are their facilitation skills, right? So this is how the student gives feedback or assesses the tutor. And finally, in St. John's, we have a self-directed learning questionnaire. Like Dr. Lakshmi mentioned, one of the strengths of PBL is that it enhances the self-directedness of students. So we have a self-directed learning questionnaire which we administer to the students before and after the PBL program. And these are the broad areas that are covered in the questionnaire. One is the awareness of students about their learning needs. The second is the learning strategies that students employ to cover the gaps that they have identified. What learning activities do they engage in? Fourth, whether they have developed the skill of self-evaluation. And fifth is the interpersonal skills, because interpersonal skills are essential for self-directed learning. So these are the 5 broad areas that are covered in the questionnaire. When do we assess, right? So like I said, informal feedback is given at the end of each problem or session. So that's constant, right? The informal feedback. And we administer the questionnaires at the end of the program. And our program is of 2 months duration. Dr. Sejal will take us briefly through the design of our program. And the self-directed learning questionnaire is administered before and after. And we've consistently found that the self-directedness improves after the PBL session. And we have two problems that we give the students, and the concept map grading is done at the end of each problem. So what do we do with the results of the assessment? Right? So we make a brief presentation to the students and the faculty and to our dean about the results of the assessment. And more as important is that we use the results of the assessment to improve the program for the next year. Right? So it serves as a feedback for both students, faculty, and to the system, so as to improve, so that it gives us ideas to improve the program as a whole. So we come to the end of the session, and just to summarize, we looked at 4 important questions in relation to PBL. We looked at what we assess in PBL, and that is intrinsically linked to the objectives of PBL, knowledge, attitude, and skills, which we've already mentioned. Second is who assesses. Like I mentioned, it's like a 360-degree assessment. How do we assess? We assess the content and process. Content, we in St. John's use concept maps, and process, informal feedback and questionnaires. We use these 2 methods for assessing. And when we assess at the end of each session and at the end of the program. So thank you so much for your patient hearing.
Thank you, Nachiket. We have had 2 questions. One is Dr. Manjunath. Sir, have you done program evaluation, and have you found PBL yielding better results than traditional methods?
Okay, sir. Thank you for that question, sir. I think it's the most important question. So I'll tell you what we have found so far. So what we have found so far is that the self-directedness of the students improves. So we've actually published that. So that certainly it does. The second thing we've done is that we have used the results of the feedback to improve the program as a whole. But whether the examination results of the students improve after PBL as compared to a traditional curriculum, we have not done that. We have not done that. And that perhaps is a little difficult to do. But Dr. Lakshmi has done a project where she has looked at the challenges and the benefits that have been gained by facilitators from the PBL program. So that in a sense is an evaluation, and the facilitators seem to have benefited a lot from PBL. So it's circumstantial evidence, sir, Manjunath sir, but it seems like PBL is working. But I do agree it's circumstantial. We do not have hard evidence to show 2 things. One is whether PBL improves exam results, whether PBL makes better doctors. So those are very difficult questions to answer. And but it seems like PBL is certainly helping.
So, I think the 4 of us here are proof of what PBL has done to faculty. One more question is concept map same as mind map? This is by Dr. Vidisha Vallabh.
Yeah, actually there are some differences between a concept map and mind map. There are some subtle differences, but the basic premise is the same. So you have a concept, right, which you look and you see the different sub-concepts in relation to that concept or different facts, and you see how they are connected. There are some technical differences between the 2. In that in one you use pictures. I think it's a mind map that you use pictures, whereas in the concept map you use mainly words. But essentially you can think of them as achieving the same objective in trying to connect and look at the big picture in relation to a topic.
That's all.
Thank you so much, Dr. Lakshmi. I think we will now call upon Dr. Sejal to present, and I'm sorry, Jaiprakash sir, we may have to go over time a little bit by 5 minutes.
Yeah, please go ahead, sir. Please go ahead.
Thank you, sir. Thank you, sir. Over to Dr. Sejal.
Thank you, Dr. Nachiket. Is my slides visible?
They are visible, Dr. Sejal.
Okay, thank you. Thank you, Dr. Nachikeet. In this mini session, we'll be looking at some key points to consider while designing and implementing a PBL program in your respective institutions. Okay, some of you might already have a robust PBL program in your colleges. Okay, but for this session, we will take an example of an institution that is yet to start a PBL program. So where is the starting point? Where do we start? The starting point would be the needs assessment. Okay, do we actually need a PBL program in our college? If such a need is felt, then this would be followed by the identification and training of facilitators who will play an integral role in the PBL process. And once the facilitators are trained, the clinical problems or cases can be designed for the program. The trained facilitators can now be tasked with designing the problems and triggers, or these problems can be sourced from a collection. If it's already created, this collection can be used to source the problems. Once these are in place, the program can be implemented, and this is a PBL program for the students, and this can be implemented. And finally, like with any other program, the PBL program also has to be evaluated, and the insights that we get from the feedback and from the tutors, we can fine-tune the PBL program for the following batches. We will now look at these steps in a little bit more detail. Needs assessment. Do you need PBL? And if so, what are the objectives? If you remember from an earlier session, the PBL could be used to enhance the knowledge of the student, the knowledge base of the students. And in fact, some of the universities, I think as Dr. Lakshmi said, in some of the universities abroad, the entire curriculum is structured as a PBL program. This is the content and the cognitive domain. The PBL program can also be used to focus on the process. And this will enhance the other qualities that an Indian medical graduate is expected to have. Things like qualities such as lifelong learner, teamwork, leadership, communication, analytical skills, and the research part of it. You could also use PBL to target both these domains, the content and the process part of it. The second question that you need to ask is, can you implement PBL? And if so, at what level can you implement PBL? Remember, PBL program is a very resource intensive task, especially with respect to faculty and with time. So depending on the availability of these resources, the PBL program could be implemented at institution level, where all or some of the departments have a PBL component taken together. The example that I can give you is TB or HIV could be taken through a PBL with the departments of pathology, microbiology, and medicine taking the lead. Or it could be at a department level where some topic in the curriculum, such as myasthenia gravis in physiology, could be taken as a PBL session. It could also be implemented at a staff level where each medical educator can convert his or her tutorial batches into a PBL session. Some of the key components which will decide at what level you can implement PBL would be the college management. Remember that support from the college management is very essential. Sometimes the management will need convincing, as a PBL program is not directly linked to, it's not directly exam oriented, and the essentiality of this program might be questioned by the college management. Getting the required number of staff, interested staff as facilitators might also be challenging. The academic calendar for the students is already packed to the brim, so to speak, and getting protected time for the PBL sessions could be a key factor. Since the PBL program happens in parallel small group sessions, finding the right venues for the duration of these sessions will also be looked into. It will also help if these venues have a projector or a blackboard or a whiteboard to help with the learning process. The second step would be the facilitators training. As mentioned earlier, the facilitators play a very important role in the PBL process, especially in the initial part of the group forming. Faculty who are interested and who can set aside the required time for the PBL sessions should be identified. They need to be sensitized about the PBL process, the roles and responsibilities, and the logistics of the program. This is usually covered in a facilitator's workshop that we conduct for the interested faculty. It also helps if a pool of such faculty is created and maintained in an institution. so that these facilitators can be rotated in the consecutive years. An ongoing yearly facilitators training workshop could be considered to add faculty to this pool. Once the facilitators have been identified and trained, the content, that is a problem, have to be designed. The selection of problems is rather critical and could be based on the relevance of the clinical condition and how well the clinical condition lends itself to the PBL format. It is preferred to go with a broad topic for the problem, such as diabetes, tuberculosis, HIV, etc., as the learning could encompass multiple subjects rather than more focused topics like BPH, refractive errors of the eye, which may limit the subjects that could be involved in this process. For each of the problems, you have to develop triggers, and these triggers would be the nidus around which the learning will happen. In St. John's, we create 2 triggers for each problem. The first trigger will cover the history and clinical examination, and the second trigger will cover the investigations and the management of that particular problem. And these triggers will be sequentially exposed to the students as part of the PBL process or the PBL schedule. I think the impression that was given so far is that PBL is usually thought of as an open, free-flowing discussion among the students to address their own learning needs. But it's always good to have a list of learning objectives to make sure that the relevant learning has happened during the sessions. If some of the learning objectives are not adequately addressed by the students during the discussions, gentle nudges can be given to make sure that those learning objectives are addressed. And it always helps to prepare a tutor guide, which will be like a framework for the discussion of that particular problem. And finally, the created triggers and problems have to be refined through multiple discussions to make sure that they address all the learning objectives. I will give you an example for such an issue. For example, if you're looking at a HIV problem, if the psychosocial and the economic aspects are not being adequately covered in the discussion among the students, then the PBL trigger could be modified to include, to make sure that such a point is discussed. Maybe we can add a line like, the patient lost his job when his employer came to know of his HIV status. If you put this into the trigger, then this will lead the students to discuss the psychosocial and the economic considerations. Now, once we are done so far, we have to look at program implementation. So before we start with the actual problem, the PBL program for the students, we have to make sure that certain requisites, prerequisites are set in place so that the PBL program can go on well. The first consideration would be the support from the management. I think this we covered a little bit before, and this is especially required for the logistics and the scheduling of the PBL sessions. The appropriate student group has to be identified. In St. John's, we felt that the 4th term students are more apt because they would have finished the preclinical years, they would have a foundation in the preclinical years, and they would have started with the clinical postings. And in addition to that, in 4th term, they do not have summative exams that they have to attend, and they can dedicate more time for the discussion. The scheduling of the sessions are very important, and they have to be included into the academic calendar of the students so that all departments equally share the time slots allotted to the PBL sessions. The facilitators have to be allotted to the groups. Even preclinical and paraclinical facilitators can be included, even though the PBL program itself is a clinical one. As mentioned before, we need to have adequate infrastructure to make sure that all the sessions can be conducted effectively. These are the prerequisites that we need to have before we start with the PBL program itself. What is next? We start with the PBL program. The PBL program for the students will include, we have the student workshop. We start with the students workshop. So it follows this sequence. We have the students workshop, and in this students workshop, we have an orientation to the PBL and its process. There's a search skill workshop where the students are taught how to search the internet for reliable sources of information and how to access physical journals and books in the library. There is also a mock PBL where the students are grouped with their facilitators. And this is to make sure that ice breaking happens and the ground rules to be followed are set in place for the future sessions. The students' workshop is then followed by the PBL sessions and the assessments. The PBL program concludes with a valedictory, and in this, the certificates are issued to all the students and to the faculty members. Before I conclude this very short program logistics session, let me share with you what we do in St. John's. So we had initially planned for the PBL program this year to be conducted in the month of Feb and in the month of March. We start off with the students oriented the workshop, the students workshop, in which they get oriented to the PBL processes and the search skill workshops. We then have a mock PBL that is conducted around a week later. And this is to make sure that they get familiar with the facilitators and with their own group members, and they set in place the rules to be followed for the following sessions. A week after that, we have they start working on the trigger one of problem one. Okay, so remember that every problem has 2 triggers. So on the 10th of Feb, we had planned for the first trigger to be released to the students, and the students will assemble and they will read the trigger, they will brainstorm the trigger, and they will identify knowledge gaps, and they will create for themselves assignments that they have to read and prepare for the next session. So for the next session, which will be on the 18th, they will come back with the assignments completed. That is, they would have prepared mentally what the knowledge gaps they had in the previous session, and they will come and discuss the assignments from the previous trigger. They will read and work on the trigger 2, and they will prepare the knowledge gaps to be discussed later. They come back in a week's time, and they have the closure of problem 1. They have the closure of problem 1, and here they will make sure that they go through the entire problem and summarize the problem so that they have closure on the problem. This will be followed by the submission of the concept maps. So based on whatever they had discussed during these 3 sessions of problem 1, they will prepare a concept map and they will submit it, which will be graded by the facilitators. Now this entire process will be repeated for problem 2. So the problem 2 trigger 1 will be released on 5th of March, and then the problem 2 trigger 2, and then finally the closure of problem 2. They will have to submit the concept maps in a week's time. That's on 23rd of March. And then finally, we have the valedictory, which is on the 26th, where they are issued the certificates and the certificates. So, so this is basically what we had planned for this year. Unfortunately, due to the pandemic, we could not complete a few of the sessions in the month of March. So what we did was we converted some of these sessions to an online mode. We formed small groups. The students were part of it. The facilitator was part of it. And we tried to have these sessions online. And I would say it did serve the purpose of having the discussion effectively. We also need to rethink about this of the PBL program and its logistics in this coming year because of the revised curriculum of CBME and the fact that the second year is shortened. So we need to really rethink about the coming batches of PBL. So before I conclude, let me just recap what was covered in today's session, in this session. So we have a needs assessment. We need to find out whether the institution requires a PBL program. The second step would be facilitators training to make sure that they are sensitized to the PBL processes. We need to create problems with the triggers and the tutor guides and the learning objectives. And finally, we have to implement the program. that is the PBL sessions and the assessments. And finally, depending on the feedback that we get from the tutors and from the students, we have to fine tune the entire program for the future batches. I think all of you will have a lot of questions based on logistics of the PBL program. It's a very resource intensive task, and hopefully we'll be able to address this in the question and answer session to be taken later. Over to you, Nachiket, and thanks for hearing.
Thank you, Dr. Sejal, for that excellent presentation. In 10 minutes, you managed to summarize the entire process that we follow here in St. John's, and that's really good, really fantastic. So I don't think we have time. So we've tried to do our best in trying to answer your questions, but I'm sure there are a lot of unanswered questions. You can please feel free to be in touch with us after this workshop as well, and we'd be happy to answer any questions that you have after this workshop. I think you can get our emails from Dr. Jaiprakash, and you can be in touch with us if you're further interested in exploring PBL. So thank you so much participants for your patient hearing and for your encouragement. Thank you so much, Dr. Jaiprakash sir, NTTC and Department of Medical Education, JIPMER, for inviting us. It was really a pleasure and privilege for us to be part of this program. And of course, on behalf of the PBL group, thank you all. So thanks so much.
So thank you, team St. John. I thank you very much for clearly presenting the concept, principles, and applications in PBL in an interesting manner. The message that the nature of PBL is constructive, collaborative, contextual, and self-directed was clearly presented. The message that problem-based learning is an effective way of delivering medical education in a coherent, integrated, and focused manner was also discussed well by your team. PBL fosters application of knowledge to complex problems, which is essential for quality care of patients. I think you all will agree with this. No doubt, PBL is an innovative and challenging approach to medical education. It is innovative because it is a new way of using clinical material to help students learn. And it is challenging because it requires the medical teachers to use facilitating and supporting skills rather than didactic ones. So PBL has several advantages over conventional method of teaching and learning, and it is an approach much favored by the curriculum planners. On behalf of Department of Medical Education, JIPMER, I thank the speakers for their enlightening speech in an organized manner and for sharing their thoughts and experiences on PBL. I hope the participants would have benefited out of today's webinar. And again, I take this opportunity to thank all the participants for their patient listening and attention. And I'm looking forward for more collaboration and interaction from all of you. So thanking you. Thank you on behalf of JIPMER and the Department of Medical Education. And with this, I am signing off. Thank you once again, dear faculty and the team St. John's. Thank you.
Thank you. Thank you.
Thank you, sir.